Allergic to pollen? Sure. Dust mite? Absolutely. But luckily, you cannot be allergic to learning. In today's class, we are exploring allergies because understanding what makes you itch, sneeze, and wheeze is nothing to sniff at. Over 50 million people in the United States suffer from allergies every year. Allergies occur when your immune system overreacts to otherwise normal substances, which we call as antigens. The body makes antibodies called IgE antibodies, which then causes a release of chemicals like histamine and many others, which in turn leads to allergic reactions and symptoms of itching, sneezing, skin rashes, etc. So now we're going to talk about the different types of allergies that we see in patients. Food allergy. The common food allergens that most people hear about are peanuts, tree nuts, fish, shellfish. The next one is environmental allergies, your pollen allergy, allergy to dust mites, allergy to animal dander. The third one is drug allergy, allergy to different antibiotics and other medications like chemotherapeutics. And then allergy to insects, which is the stinging insects like honeybees, yellow jackets, hornets, wasps, etc. When we see a patient with allergies, we want to determine what they are allergic to. Hence, we use these devices that are dipped in wells that carry different allergens, like food allergens like peanuts, milk, egg, or environmental allergens like pollen, dust, dog, cat. These are applied on the forearm, and then you look for an allergic reaction, which is usually like a mosquito bite with some swelling and redness around. And then in children, you could do the same test on the back. So when we say prick testing, it really doesn't hurt too much. It feels like a little tiny mosquito bite-like feeling, or a prick, or a cat scratching you. Now let's talk about a few misconceptions around allergies. Hypoallergenic pets won't trigger allergies. That is not true, unfortunately, because all animals will have the skin, the hair, the dander, the saliva, which are responsible for causing the allergies. The hairier your dog is, the more allergies you may have, because the more allergen you're exposed to. You can outgrow all allergies. Unfortunately, that is also not true. However, allergies do vary with age, and some patients will get better as they age. But there is really no cure for allergies. You can only control them. Only children develop food allergies. That is also not true. As adults, many people can develop allergies, and the common food allergies in adults are fish, shellfish, tree nuts. You can develop these allergies as you age and get more and more exposure. You can't have an allergic reaction to medication if you've taken it before. That is not true. People can develop allergy to any medication at any point in their life, even if they've taken it several times before without any reactions. If you're stung by a bee once with no reaction, you'll never develop an allergy. That is not true. Most patients will develop an allergic reaction on their subsequent stings, even if they've been okay on the initial one. So that's a nice wrap on today's class. Hopefully, we have been able to give you tools for you to understand why you itch, sneeze, and wheeze.